Good morning. It's Dr. Chris Lauria speaking to you from this Centers of America in Roanoke, where we help people with low back pain, sciatica, uh, neck pain, arm pain, using non-surgical treatments for chronic pain due to conditions in the spine. Today, well, let me give it a minute here, just a couple more seconds. There's some people signing in to follow this morning's live. Merry Christmas to everybody. Decided to do one this morning because this next week will get kind of busy for all of us. So enjoying our families, enjoying the holidays. So I had a question that a lot of patients asked me that I wanted to answer quickly this morning. So let's get started. I get a lot of people asking me and coming to me saying they have sciatic pain, and sciatica is pain, numbness, tingling going down one or both of your legs. And it's when the sciatic nerve gets irritated and pinched, and that can lead to those symptoms. There's multiple things that can cause that, which we'll touch on briefly. One of them is called the piriformis muscle. And I have patients that come in and say, I have piriformis, or I have a bad piriformis. And they really don't understand what that is or what it means to have a piriformis muscle spasm or a piriformis syndrome leading to their uh, sciatic pain, numbness, tingling in their legs, and those type of things. Let me explain. The sciatic nerve is a large nerve that comes off of 3 to 4 levels or multiple areas of the spine. These nerve roots come out of the spine and they come together and form one large nerve that runs down your legs. And it's a big one. It's a little less than the size of a pinky finger. And it runs all the way down specific areas, down the back of your leg, around your calf muscle, and all the way to certain parts of your foot. And there's multiple things that can cause that nerve to be irritated and lead to sciatica. Number one, and the question is the piriformis muscle. The piriformis muscle is a muscle in your pelvis that has multiple functions, but that piriformis muscle is like a web with my fingers together like this. And it's like I said, it's got multiple functions. And the unique thing about the piriformis muscle, it has a hole in the middle that the sciatic nerve actually passes through. So problems with the piriformis muscle can cause sciatic pain. The piriformis muscle can become very tight and get into spasm, which leads to sciatica. You can injure or do something to your pelvis that causes the piriformis muscle to be damaged or to spasm up and lead to sciatic pain. So it can be caused by injuries and traumas that the piriformis muscle itself is compensating for something that went on, which is leading to that whole pinching and irritating the sciatic nerve. The other thing, the piriformis muscle could be compensating due to a problem in another area. And what we find typically, because we get patients that come in and say, yeah, I went to physical therapy, they worked on it, they give me these stretches where you pull your leg to the side, it stretches the piriformis muscle, and it feels good. It relieves it for a certain period of time, but it comes back. And then we stretch it again, or we massage it, or do different things, trigger point work to relax it, and it helps, but it comes back again. Well, that tells us that the piriformis muscle is actually compensating and guarding of another problem, and that's why it continue to spasm up. Okay, typically that comes in the spine, and if you have spinal low back problems, alignment issues with the lower back or your pelvis, or you have degenerative conditions in the spine with bulging, ruptured, herniated disc, arthritic spines. Now the body, the pelvis, the low back, the legs, the piriformis is trying to guard that area and protect it. And when it guards it and protects it, that piriformis muscle will spasm up and cause a sciatic pain. It could also be nerves are being pinched and irritated where those 4 levels come out of the back due to a disc problem. So you might have 2 things affecting the nerves going down your legs and causing the sciatic pain. What could be 1 from the lower back issue, 2 from the piriformis being pinching the sciatic nerve. So the key I tell every patient is to get a correct diagnosis, understand exactly what the cause of your problem is. If it's a true piriformis muscle problem, then you need to get that treated. Or if the piriformis muscle is protecting, guarding, compensating for another problem, you need to find out the cause of that too. And once you treat the cause of the problem, if it's in another area, that piriformis muscle will relax and stop affecting the sciatic nerve. So hopefully that helps you understand what piriformis muscle is, what piriformis syndrome is. This is something that we specialize at Disc Centers of America on working with people with low back problems, piriformis problems, people who are dealing from sciatic pain in multiple causes. We're able to treat those conditions, find out what the cause of the problem is, see if you're a candidate for one of our treatment protocols to help relieve the sciatic pain, which can be devastating. I understand. I dealt with that myself probably about 7 years ago. So I know how bad it is. But the key, I found out the cause and was able to treat that, and now I don't deal with that anymore. So, if you're interested, if you're dealing with sciatica, if you're dealing with piriformis syndrome, which just keeps coming back, no matter how much you stretch it, no matter how much you work on it, and you want to try to find out what the true cause of your problem is, you can call our office at 540-600-4630. We offer complimentary consultation, review of MRIs, all those type of things to determine if we can help you with your sciatic pain in the office. If I can't help you, I'm going to send you the right person to help you if it's not something that we treat. So I hope you enjoyed today's talk. I hope everybody has a very Merry Christmas, a wonderful New Year, and we'll be kicking in and doing these again probably starting next year. And if you have any questions, you can go to our website, www.roanokedisccenter.com. I think that's listed. If you just want to speak to me, you can leave a comment on this site on Facebook or LinkedIn with a question, or you can call and just speak to me on the phone. I'm happy to answer any questions you might have. Okay. So Merry Christmas. Happy holidays. Thank you.